This is our assessment comparison analysis of VB-MAPP versus PEAK. I'm Mariah Hurley.
I'm Alex Haggerty.
I'm Ayana Ellis.
My name is Miranda Kerwin.
And I'm Audrey Thomas.
First, we're going to discuss our client profile. His name is Marty Hardy, and he's 3 years old and 4 months. He was recently diagnosed with autism spectrum disorder, and his current level of functioning is that he speaks in one-word utterances, focused mostly on no and okay. He rarely speaks in full sentences and struggles to label things in his environment and identify various people. He also has issues engaging with peers and struggles to follow and understand directions. ABA was his recommended next step for Marty, as he was referred due to his deficits in communication, his social skills with peers, and he lacks both independent play and leisure skills. Caregivers' hope is for him to attend a least restrictive school setting in the near future.
So the first assessment we are going to look at here is PEAK. PEAK is set for ages 2 to 17 years old, and their main purpose is to expand on basic skills to teach a wider range of skills that will follow the child throughout the life. There are 4 different modules of PEAK: direct training, which focuses on basic elements of communication; generalization, which is to gain and maintain skills based on new contexts; equivalence, which focuses on problem solving and critical thinking; and transformation, which takes on perspective taking and comparisons. The data collection looks like an indirect assessment filled out by caregivers and teachers. The pre-assessment is filled out by therapists, and then direct testing is used to test up to 184 different things.
The other assessment we'll take a look at is the VB-MAPP, and this is for ages 0 to 4 years of age. The purpose of this assessment is to identify an individual's skill level and any gaps in language development. Some of the skills assessed include demands, echoing phrases, labeling items, social skills like playing, group and classroom skills. The data collection is a form, and this is divided up into 3 different levels based on age of the individual, and direct observation is used for this.
All right, for PEAK, they have an indirect assessment, which is a questionnaire filled out by the parents or teachers, and its answers are yes, no, and I don't know. The pre-assessment is a direct assessment, and it's a 2D visual material, and the direct testing is similar to the pre-assessment, but it just uses 3D material. PEAK is limited because the research only samples a small size of participants, and it has lack of procedural fidelity. However, it demonstrates high level of reliability and validity. And for utility, it establishes an age-appropriate skill guide that compares the abilities of their neurotypical peers that will follow them as they grow and develop.
Okay. So for the VB-MAPP, the scores range from 0 to 1, 0 showing the absence of a response or an incorrect. For limitations, only the verbal repertoire of a typically developing 4-year-old can be measured. When it comes to validity, scores of the VB-MAPP provide valid information relevant to the target behaviors of interest. And lastly, for utility, it provides an appropriate curriculum guide and assessment tool that is compared to a neurotypical aged peer.
So what's better for Marty? We chose the VB-MAPP as the best assessment, as it is seen to fit the recommended age range of Marty. It also targets classroom skills, which is a goal for the caregivers.
It also works to fill gaps in verbal behaviors to a peer's range, and will help identify skill level and build foundational skills around barriers.
Some of the cons of PEAK and why we didn't choose them is that it's time intensive to fill out. It lacks extensive research with a wide variety of individuals. And the last 2 modules lack training and teaching instructions. So overall, the VB-MAPP is a better fit for Marty.
That's our presentation. Here's our references. Thank you.